ਕੀ ਤੁਸੀਂ ਮੋਟਾਪੇ ਤੋਂ ਪਰੇਸ਼ਾਨ ਹੋ, ਜ਼ਿਆਦਾ ਭਾਰ ਤੋਂ ਪਰੇਸ਼ਾਨ ਹੋ ਜਾਂ ਮੋਟਾਪੇ ਕਾਰਨ ਸ਼ਰਮ ਮਹਿਸੂਸ ਕਰਦੇ ਹੋ ਤਾਂ ਹੁਣ ਘਬਰਾਉਣ ਦੀ ਕੋਈ ਲੋੜ ਨਹੀਂ। ਜੰਮੂ ਹਸਪਤਾਲ ਵਿੱਚ ਆਪਣੀ ਸੇਵਾ ਦੇ ਰਹੇ ਡਾਕਟਰ ਗੁਰਵਿੰਦਰ ਸਿੰਘ ਜੰਮੂ ਕੋਲ ਹੈ ਤੁਹਾਡੇ ਮੋਟਾਪੇ ਦੀਆਂ ਪਰੇਸ਼ਾਨੀਆਂ ਦਾ ਇਲਾਜ। ਵਧੇਰੇ ਜਾਣਕਾਰੀ ਲਈ ਸੰਪਰਕ ਕਰੋ ਕਪੂਰਥਲਾ ਰੋਡ ਨੀਅਰ ਸਪੋਰਟਸ ਕਾਲਜ ਜਲੰਧਰ। ਫੋਨ ਨੰਬਰ 0181 22 मोबाइल नंबर 9814 70 870। वेबसाइट www.jammuhospital.com।
Bariatric surgery or weight loss surgery, or popularly known as gastric bypass surgery, is a final solution to morbid obesity and type 2 diabetes. It has been proven beyond that this surgery, with the help of this surgery, one can get rid of the morbid obesity and the diabetes. This surgery can be done for all our age groups. We normally start doing the surgery from the age of 18 till the age of 65. There are various procedures done under the heading of bariatric surgery. For example, lap band, lap gastric sleeve resection, and Roux-en-Y gastric bypass. There are various other procedures which are little less popular, like mini gastric bypass, duodenal switch, etc. It all depends what are the indications and what kind of is the weight and what is the nature of the patient. So what kind of procedure a patient can stand. So it all depends. So we decide the procedure to be done on that particular patient. For patients who have obesity along with type 2 diabetes, the gold standard procedure of choice is Roux-en-Y gastric bypass. For the patients who are binge eaters, overeaters, the procedure of choice would be lap band or lap gastric sleeve resection. In this bariatric surgery, we try to identify the cause of obesity. If the patient is binge eater and is a habitual eater, he or she overeats, in those patients, the size of stomach would be larger and the patient has to gulp in more food to reach the satiety. So in those cases, we normally do lap band or gastric sleeve resection, in which we reduce the size of stomach according to patient's height, so that he feels less hunger and he reaches satiety very soon. In this way, he can lose about 5 to 6 kgs of weight per month, and this weight loss will continue till about 18 months. But the resolution of comorbidities like diabetes and high cholesterol and snoring, that can be achieved with sleeve resection, like a restrictive procedure like sleeve and band, but to a little less extent as compared to bypass procedures. So this restrictive procedures like lap band or lap gastric sleeve resection is mostly restricted for the patients who are overeaters and who are obese, that is their BMI is more than 35 or 36. For the patients who suffer from comorbidities like type 2 diabetes, high cholesterol, snoring, etc., we normally do bypass procedures, out of which the gold standard one is Roux-en-Y gastric bypass. In Roux-en-Y gastric bypass, increase the size of stomachs, and the second thing we do is we bypass a segment of proximal small intestine about 150 centimeter, depending upon how much the area is to be bypassed. So it is going to help in two ways. One, the pouch of stomach is very small, so feel less hunger and your satiety will reach soon, faster. And the second thing is the absorption will decrease because we are bypassing about 150 centimeters of proximal intestine. After this procedure, a patient can lose 5 to 6 kgs of weight, and this weight loss might continue for about 18 months. The resolution of comorbidities like type 2 diabetes, high cholesterol and snoring is more than as compared to the restrictive procedures.
ਕੀ ਤੁਸੀਂ ਮੋਟਾਪੇ ਤੋਂ ਪਰੇਸ਼ਾਨ ਹੋ, ਜ਼ਿਆਦਾ ਭਾਰ ਤੋਂ ਪਰੇਸ਼ਾਨ ਹੋ ਜਾਂ ਮੋਟਾਪੇ ਕਾਰਨ ਸ਼ਰਮ ਮਹਿਸੂਸ ਕਰਦੇ ਹੋ ਤਾਂ ਹੁਣ ਘਬਰਾਉਣ ਦੀ ਕੋਈ ਲੋੜ ਨਹੀਂ। ਜੰਮੂ ਹਸਪਤਾਲ ਵਿੱਚ ਆਪਣੀ ਸੇਵਾ ਦੇ ਰਹੇ ਡਾਕਟਰ ਗੁਰਵਿੰਦਰ ਸਿੰਘ ਜੰਮੂ ਕੋਲ ਹੈ ਤੁਹਾਡੇ ਮੋਟਾਪੇ ਦੀਆਂ ਪਰੇਸ਼ਾਨੀਆਂ ਦਾ ਇਲਾਜ। ਵਧੇਰੇ ਜਾਣਕਾਰੀ ਲਈ ਸੰਪਰਕ ਕਰੋ ਕਪੂਰਥਲਾ ਰੋਡ ਨੀਅਰ ਸਪੋਰਟਸ ਕਾਲਜ ਜਲੰਧਰ। ਫੋਨ ਨੰਬਰ 0181 22 मोबाइल नंबर 9814 70 870। वेबसाइट www.jammuhospital.com।